it's saying I can, so.
Okay.
Welcome, everybody. Thank you so much for taking some time to join us, and for all of you that participated in our community check-in. We just wanted to share back all the great information we got. And so myself, I am Lorez, Executive Director for Caring for Denver. And Monica, you want to introduce yourself?
Yeah, I'm Monica Amador. I'm the Community Engagement Associate. Thank you for being here, everyone.
So we are going to walk through a couple slides that really summarize both the process and what we learned, and then really want to hear from you if we got it right, or if there are questions or more you want to know. There is an opportunity to chat the questions, and we will answer them to the best of our ability. And so with that, if we mention any resources, we'll make sure to put those also in the chat for you as well. So again, so grateful everybody is taking their time to be with us today and to have been a part of this Caring for Denver community check-in.
All right, so I will kick us off. If you have all been a part of our Facebook Lives in the past, we reached out back in, when was that? A few months ago, we hosted a Facebook Live, and so this map may look familiar to you. So that big, beautiful green arrow is showing you that we are now in that January and beyond phase. So we have had all the conversations, we sent out all the surveys, received them, and went through all that data. And so now we're here to kind of talk about what we've learned, and still to continue and ask for you all to provide feedback. And a reminder as well that even though we did a really big push back in 2022 for this community check-in via the surveys and the conversations that we had, just a reminder that we actually integrate community engagement, community voice throughout the entire year through our grant process. So just a quick reminder on that. So this slide here is showing you our goals for the community check-in, which consisted of those surveys and those conversations we had in person. I believe we actually also hosted some over Zoom as well, so virtual. Our biggest goal is to make sure, because we serve all of Denver, that we had a very diverse group of voices giving their thoughts and feedback on our work and the questions that we asked. And so we have a few bullet points here showing how we did just that to make sure that we got as much diversity. So we had a digital ad campaign to really target around 18 to 65-year-olds who were living within that 25-mile radius in Denver, and also making sure that underrepresented zip codes were targeted so we could hear that feedback. We also really appreciate all of our grantees. They're a big portion of what we consider a community, but keeping in mind that they're not the only community we like to reach out to. So we did have our grantee communication. We did have a few conversations in person where our grantees set up a meeting, or we were invited to an existing meeting so we could sit in and talk to participants and people that receive services at our grantee organizations. We also had multiple flyers go out. We dropped them off at the Denver Museum of Nature and Science, really appreciative of that. And we also made sure to reach out to the business community as well, making sure that we were reaching communities that we may not normally get to be a part of. That's really important to us. And so on the flip side of that as well, we did a few tabling events out in Westwood. Those are the ones that I remember the most. Those are amazing. There, oh, technology sometimes.
Yep, just working on this. Hold on a second. There we go.
There it is. All right. And so, like I mentioned before with that slide of the map that you all saw, if you had joined us in our previous Facebook Live talking about our community check-in with the surveys and questions, you also may recognize this map, which shows us exactly, it's like the inverted L in Denver, showing us what neighborhoods need the most resources really in order to thrive. And so it looks like with our survey, this is showing us where we had the most response, or all responses really. So really focusing on District 9. And then let me see the other numbers going down. Biggest one as well, back at South Denver in the District 4. So really making sure, again, just a really helpful visual that we reached all of Denver through our survey, because that's what we're here to do. And this is awesome. I am a big fan of numbers and pictures. We gathered some pictures from the conversations we had, and it shows you here in the slide that we had over 1,000 individuals complete the surveys, including people who live, work, and get services in Denver. And then we had over 790 community members participate in the community conversations. And so that's where the community engagement team really sat in those spaces of meeting people where they're at, asking them to just be in conversation with us and giving us their honest feedback on what's going on in Denver around mental health and or the substance misuse needs that they're seeing for themselves and or their loved ones and their community.
Great. Oops. All right. Love technology always. So again, want to thank everybody that participated. So Monica did a great job of just sharing how we sought out community voice, and always community, as Monica said, is at the center of everything that we do, in that we were a foundation that was created by and for Denver. And so we want to always make sure that community voice, that expertise that is known in community, is what is driving our work. And so this really speaks to the questions that we asked folks. So what parts of the ordinance feel most important to Denver community? And basically, even 3 years after we've started, all of those feel significant and important, just given in the times that we're living, the stress, the uncertainty that people are feeling, that everybody thought that mental health, substance misuse, suicide prevention, that coordination, case management, and alternatives to jail was still very important. Which areas, we asked, resonate the most? People talked about their young people and their young people struggling, especially after the pandemic, as well as having those solutions that are based in community and community knowledge and expertise feel the most critical. And it wasn't that the other areas weren't important, but those resonated the most right now. What was going well with Denver's mental health and substance misuse systems? People really spoke up about peer supports, those peer specialists, and the partnerships that exist between mental health responders and first responders, just the importance of creating those alternative pathways. But overall, the needs for care have grown, and so accessing care still remains difficult. And so there needs to be that continued focus on accessing care. What still holds true, we know that when we started in 2019, it was pre-pandemic, and a lot has changed in 3 years. And so what still holds true is stigma, a need for more long-term recovery options, and again, that access to care, that there's still barriers to getting mental health and substance misuse. And then we asked specifically, how has it changed over this last couple of years? And so while folks might still be in part of the pandemic, there was really, when we were talking to people, as Monica showed you during that timeline, people are feeling more economic and social stress. That was more present, creating a demand for care. And then again, finding that care that fits, that reflects people's culture, identity, reflects who they are, especially in communities of color, making sure that care is, they're seeing themselves in their care. It feels safer and less stigmatizing when that happens. So in hearing all of that, there were some key takeaways. Some of it was, some of the work we're doing is right on, and we need to keep on doing that. And so again, we heard that the areas we invest in are still the right areas. that we've really created or helped support the creation of a community care system. How do we then, though, continue to support and recognize that crucial role of community care system? What we also heard is that care and resources, while people need mental health care, they need other resources like education, employment, social supports. And the navigation between systems or between organizations is really difficult. And really this request of, could we make sure we fund or partner with organizations who not only provide the mental health, but co-locate that within other supports, maybe education supports or employment supports or social supports, to really co-locate those services that make it easier for people to access, and in spaces they're already at with people that they already trust. And so we will continue to look at that and focus on that. You might see that now show up in some of our key considerations when you see our call for proposal. They want to see more options for care that fall between stability and crisis. So we have the caring community, we have crisis response, but there's needs in between. And how do we lift that up? So you will also see that as a priority as we go forward. And then remembering and remaining focused on access, and also those nuances of access, and how do we stay focused on that as a priority for Denverites. So you will see that also in our new annual report that'll be coming out March 31st is when that will be public, and we will share that, and you'll see how we lifted these learnings up in what we're doing going forward. And so with that, I think we wanted to, while we always love to talk, we really like to hear from you about, what are the questions you may have? What do you want to know more about? Did we get it right? Are we missing anything? We're just going to give you a moment or two to try to type in those chatted questions. Monica, maybe as we're waiting for those questions, is there a question or two maybe that you heard in community that you think would be important for us to talk about as people are gathering their thoughts?
Yeah, I think the biggest question I came across was, how does this work shape our focus? I know we mentioned it in the beginning and you mentioned it as well, but maybe diving a little bit more into that. That was a good question I heard.
Sure. And what I'll say, community is always at the center of our work. So just because this is part of our requirement in our ordinance that every 3 years we engage people into the use of the funds, if that's all we did to engage community, we would have failed on our mission, because our mission is to lift up community-centered solutions. And so that means talking to people more than once every 3 years, but we want to make sure that we do this part well. But the other ways that we try to really lift up and leverage community voice are community voices help shape what we put in our call for proposals, the themes or issues that are coming up. We leverage the expertise of community reviewers. We lift up stories of community to help inform what we need to be thinking about. And then, as Monica said and talked about, one of the important things is we talk to and are always available to come talk to any organization about the work we do, or host meetings, or be a part of a meeting, so that you can learn more about what we do, because communities are our best advocates to let other communities know about the resources that are there for them to do this very important work that's trusted. And so this is a piece of how we center our work around community, but it is not by no means the all of the work we do to center our work around community. And we always welcome feedback. If we're doing things well, if we're not doing things well, we are Denver's foundation. And so we really want to be reflective of the communities we serve.
I'm still monitoring the chat and I'm not seeing any questions come in. So I'll ask you, let's see, I think I got one coming in. Have you developed action steps / timelines based on the key takeaways? Thank you, Chris. That's a great question.
We are working on that right now. So, I mean, some of the things that, and that'll be specifically in our annual report. So we're putting that together. But some of the things we heard, again, we heard that community centered and youth were a higher priority, not a higher priority, but especially a priority for a majority of Denver residents. So when we create our spending plan with our board, we're putting a little more funds into the youth and community centered. A little more to reflect what we heard. So when you see our call for proposals go out, you might see larger amounts in youth and community centered than last year, not only because our income is going up, but because we tried to prioritize that more. What I do want to say is that doesn't mean alternatives to jail is going away. It meant two things for us. One, we need to continue to invest, but also help people understand that connection between mental health trauma and interactions with the criminal justice system. And so we need to do a better job of telling that story as well. One thing we did hear too that we've already implemented or in the process of implementing is the area of care provision. So we had that as a separate funding area. What community really said is care provision shows up in all of these. And so can we not just apply once in the year, but really if we're doing care provision related to alternatives to jail, let us apply there. If we're doing care provision with youth, let us apply there. And if we're doing care provision related to community centered, let us apply there. So in reflecting that, we will have care provision be a part of each of those funding areas. So depending on the population you're working with in that provision of care, that'll be the area you apply in. As I said, you will see in our next call for proposal that will be alternatives to jail, some of the key provisions around that we will add to say, like, this is what we would really like to see is that co-location of services. So meaning if you are providing employment services and you are like, we really need mental health services and we want to bring in a partner or we want to provide those ourselves, that would meet that key consideration because we're not having people navigate those services as, to go to two different places. And again, it's about meeting people where they're at with trusted resources where people feel respected and understood. And it doesn't mean we won't fund mental health and substance misuse services on their own as well. It's just we'll look for those places where we can create more coordination. An example of that where we have funded and then seen better results because of that was Colorado Village Collaborative. We embedded, they provide a lot of services for unhoused related to housing supports and sort of those skill-based to be stably housed as they transition out of those safe outdoor spaces or teeny homes. We've embedded peer specialists and licensed clinical social workers. But because it's embedded with these other services, we saw a 72% take up of those services. So we know, even we've seen in our grant making, when we embed and co-locate, there's more of a take up of care. So that is one of the things you'll see. And then really trying to have conversations about what are those services that are needed between crisis and stabilization that need to be lifted up as well. So hopefully that helps answer some of it. And there's more detail in our annual report that we'll make sure everybody gets by March 31st.
Thank you. I have one from Carrie. CARE, little quotation marks, coordination across all the different agencies seems to be really important. Are there any on your nonprofits? I'm sorry. Are there any of your nonprofits folks on this right now that we might support?
I'm trying, sorry, can you say the question one more time? Are there nonprofits that are supporting system work?
Care coordination across all the different agencies. So
yeah, so we do fund organizations to do care coordination. And so across all agencies, I'm not quite sure what that means, but what I'll say this way is that we have a lot of nonprofits that are working in community, and we also fund city agencies to do work. And sometimes those both can become siloed. So wherever we can build relationships or lift up the work or make introductions, we will totally do that and want to do that, because we'll hear from the city sometimes we can't find the communities to partner with, and community organizations saying we can't break into the city. And so we can play that facilitation role. But, again, this is what I'll say is this is what can make care complicated sometimes, is what I'll say it this way. Care can be as individual as the person. When we talk about fit and need, it's about really somebody trusting the services. And so different people have different needs and different trusts. And so sometimes it can be like, who is your agency or organization working with? Is it LGBTQIA youth? Is it LGBTQIA adults? Is it BIPOC population? Is it the intersectionality of all of that? And so then those partnerships you'll want will be as reflective of the communities you're seeking to serve. So we're always happy to make those partnerships and connections. So I don't know if that completely answered your question, but always happy to talk about it more.
I'll keep a lookout to see if Carrie expands on her question. But I have one from Jenny. Did you receive input from many stakeholders on the need for trauma recovery services connected to improving mental health?
You know, we have always focused on trauma, not, you know, as a portion of and related to mental health and substance misuse care. And yes, people talked about it, especially when we talked to folks with lived experience, meaning folks that maybe are in residential treatment, folks that are recovering from addictions. So we went and talked to a lot of folks with lived experience, and at the heart of a lot of their needs was trauma. And so how do we address that trauma? With some of the same tools we would use to address mental health and substance misuse. So yes, we do it. And yes, we've heard that it still needs to be done.
And it looks like we have kind of a clarification on what we fund related to mentoring. So I'll just read the comment. This one is from Cheryl. Thank you. I am finding our youth have a high need for mentoring and or tutoring in a way that is directly correlating with their substance misuse and mental health struggles. However, the Caring for Denver funding where we're allowed is to be used for evidence-based therapeutic interventions or therapy. We are struggling to find funding for these services.
So what I'll say is we maybe clarification. We don't focus solely on evidence-based or solely on clinical interventions, but we also don't fund mentoring in that what we're about is making sure that, especially with youth, if we're going to lift up trauma, which sometimes can happen in mentoring, we don't just bring them to that trauma, but through that trauma. So what that means is, do you have the right folks on staff to help ensure that people aren't left with their trauma, especially young people are left with their trauma? So that's why it might feel like evidence-based or clinical, but we do like to see that people have certain skill sets if they're going to do this, whether that's, and we will help fund training for staff to be able to have those skills. So again, mentoring can help with well-being, but well-being, it's not always the same as improving mental health and substance misuse. And so again, they are connected and it's a determinant, but we are looking for what is that signal of progress, what is that mental health or substance misuse intervention. And again, it doesn't always have to be clinical. So I want to make sure that that's also heard and understood, but it might have a trauma-informed lens. And so you've developed a trauma-informed curriculum. But the mentorship alone is not a mental health intervention.
Yeah, I really appreciate that clarification, Laura, as that's something that also was lifted up in the community conversations we attended, really being able to share both sides of it. It's not just that one size all fits approach that you always share. So I appreciate that. Still
and
monitoring.
Also happy to continue to talk around the mentoring. So if you, was it Cheryl?
Yes.
Cheryl, if you want to reach out to me, or you know, all of our emails are our first name at Caring for Denver. So mine is lorez@caringfordenver.org. And so reach out and let's just have a conversation. And again, you need, ultimately, every community, every organization needs to do the work that's right for their community and organization. So when I give you a sense of what are the types of things we fund, that's just to give you an idea. It's not to direct you that way. So I always like to make that clear. first and foremost, your work should be driven by you and what community needs. And part of this is our ordinance also is written pretty strictly. And so that's where while we recognize the importance of determinants and social determinants in people's mental health and well-being, what our ordinance requires us to fund is really more in that direct mental health substance misuse space.
Cheryl said thank you, and she will definitely be reaching out, or they will definitely be reaching out.
Great.
So I have a question for you, Lorez, because you joined me and the rest of the team on the community engagement check-in. So I'm curious what you find to be the most meaningful aspect of this project.
You know, the most meaningful, I mean, you know, an ordinance can tell you what to do, and we can put money into community. But the most meaningful part is knowing how we're having impact in community, how we're partnering with community, walking alongside with community to lift up solutions that work for community. And I will also say one of the most meaningful aspects too was spending time with people that are living in the recovery, in the throes of, you know, recovery right now, who don't often get asked what they think is important in the solutions as it relates to maybe what they've experienced or what they've seen other people experience, that people talk about them, but not to them. And so I will say it was pretty meaningful to really just spend some time with folks that who don't usually get asked their opinion, to see their passion for this work, the passion for the solutions, their expertise, their knowledge that often gets overlooked, that we had the privilege of sitting beside and with.
Definitely. Thank you. All right. I don't see anything new coming in the chat, but maybe we can wait a couple more minutes.
Well, and maybe I'll say one more thing too while we're sitting here, because I think the opposite of the meaningful is what's the challenging side of it. And so I think what we've realized is, you know, we did our community engagement when we first started over 2 or 3 months. We did it this time over 2 to 3 months, did more planning to get there. But it's sometimes hard, you know, not everybody, that time frame doesn't work for everybody. And so that's where Monica, myself, Kendall have all sat down and talked about how do we do a better job of doing a lot of engagement over the next 3 years, really talking to people. So again, this is where please invite us in. If you want us to hear from the clients you serve or the staff you work with about what's important, have us come in to a meeting. We're happy to go anywhere, pretty much in the city and county of Denver, to talk to you about what your needs are, because what we want to do is really spend more time over the next 3 years, really pulling information so that we get to hear from everybody. And it's not just within this 2 to 3 month defined period. And then what we can do is roll up what we've heard over the 3 years and then check in with folks over that 2 to 3 month period, just to make sure it's more reflective of the Denver community at large. So I'll say it was a challenge, and how we're trying to turn it into the positive. And so it's really an ask out to all of you to say, please think of us as you're thinking about what are solutions and where you're talking to community. All right. Well, if there are no more questions, we know you all have important jobs and important work to do. And we're grateful for your partnership in the work. We're grateful for all you do, really wholeheartedly. And we look forward to continued partnerships going forward. So thank you for your time, your expertise, your knowledge, your partnership. We're grateful. We would not be as strong as we are without all of you. So thank you.
Yeah. Before we hop off, Darren, I just want to acknowledge your question. The answer is yes, and you can reach out to your program officer, but ideally you can reach out to me, Monica, at caringfordenver.org. I'm happy to be that point person and move forward and talking to your community. So the official was, does that process start by contacting our coordinator grant manager? So it was
Yeah,
a yes, sure, but you can also reach out to me, reach out to Lorez.
Yep, no wrong. We really hope there's no wrong door. You can just say, hey, we'd love to have somebody come out. We'll make sure we get the right people out, but you can start anywhere. Whatever's easiest for you is how we want to approach it.
Cool.
All right. Well, everybody keep warm and safe on this snowy day.
Bye, everyone. Thank you.